नमस्कार अ, आप सभी को। कल का जो टॉपिक था हमारा, हम जो हेड एंड नेक कैंसर के पेशेंट्स पे बात कर रहे थे, हम उसी के कंटिन्यूएशन में आज भी बात करेंगे। आज का टॉपिक है योगा रिहैबिलिटेशन इन हेड एंड नेक कैंसर पेशेंट्स बाय रिस्टोरिंग बैलेंस एंड स्ट्रेंथ एंड द होप ऑफ रिकवरी। When someone is diagnosed with cancer, life suddenly divides into before and after. For people facing head and neck cancer, that line can feel especially sharp. These cancers affecting areas like the mouth, throat, tongue, voice box, or neck often leave behind visible scars and visible struggles. Difficulty swelling, stiffness, changes in his speech, and emotional exhaustion. These all are actually highly impact in someone's life who is suffering with the cancer. But amid the challenges of recovery, more survivors and healthcare teams are discovering an ancient yet adaptive ally, yoga, once known mainly as a spiritual practice from our country. Yoga has evolved into a globally in the form of a ray of hope for everyone in most of the diseases, especially for the cancer patient. So, restoring the functions, reclaiming the peace of mind after an ordeal that can shake every layer of being. Understanding the aftermath of the head and neck cancer patients. Um, this cancer makes up about 5 to 10% of all the cancers worldwide, if we see the prevalence. Treatment often involves a combination of surgery, radiation therapy, and chemotherapy, life-saving but life altering interventions also. While survival rates have improved, rehabilitation can be daunting. Common post-treatment effect includes muscle stiffness, pain, especially around the shoulder, the areas where radiotherapy, mainly radiation uh, for the therapy purpose, takes place. Swallowing difficulties, dysphagia, or dry mouth due to radiation, fatigue and low energy, which may persist long after treatment, changes in speech or voice quality impacting communication and confidence, as well as emotional distress, including anxiety, depression, and social withdrawal. Emotional distress is actually affects a lot of things in their life. For many survivors, the goal shift from merely living to living well, regaining control, confidence, and a sense of normalcy. This is where yoga steps into a bridge between medical care and holistic recovery. Why yoga is a question, a big question. A mind body science for modern times, yoga is highly impactful for the patients with head and neck cancer patient. The gentle movements, controlled breathing like pranayama, mindfulness or meditation to promote physical, mental, and emotional balance. Over the past 2 decades, scientific research has begun to validate what traditional practices like yoga, how long the yoga enhance healing, reduce stress, or improve quality of life for the people facing chronic illness, including cancer. For cancer rehabilitation, yoga works through multiple pathways: physiological, psychological, social, or spiritual. Physical impact, if we see it, yoga improves muscle flexibility, postures, balance, reduce stiffness in neck and shoulders. Physiological lowers stress hormones like cortisol boost immune function and supports better sleep. Psychological includes yoga reduce anxiety and depression, fatigue, build self control and body awareness, encourages self acceptance, social reintegration, and a sense of purpose. Recent studies from institutions such as um, Tata Memorial and many other institutes uh, like European and oncology centers have demonstrated that yoga therapy can complement medical rehabilitation in cancer survivors. For example, in 2019 study in integrative cancer therapies found that yoga improved neck mobility, swallow functions, and fatigue level among head and neck cancer survivors after radiotherapy, एंड सो ऑन. इस तरीके से बहुत सारी रिसर्चेज हैं अ, जो इजीली एसेसिबल हैं. नाउ वी कमिंग ऑन the practical part which I want to discuss more here, comparatively the theory part and the research part. Yoga rehabilitation focuses on functional recovery, helping patients regain range of motion, relieve tightness, and rebuild confidence in movement. Below the neck area, uh, some neck and shoulder practices like mm, cat and cow pose, like which is called as Marjari Asana also, as well as Bhujangasana, neck rotation practices, and they basically effects on uh, the stiffness. They work on stiffness as well as the mobility part also. After surgery or radiation, patients often develop protective postures like uh, this. The posture changes actually due to the stiffness and pain, basically. So simple yoga awareness exercises retrain posture, which can reduce pain and improve breathing. Uh, Now, restorative poses like supported child pose like Balasana. It encourages relaxation and diaphragmatic breathing. The Like this, the reclined bound angle pose opens the chest and promote calmness. Legs up the wall pose, Viparit Karni, basically reduces fatigue and enhances circulation. Here, I want to say that these asanas are just tentative asanas. Uh, it is not like these are only these asanas are the only asanas which are effective. Every asana have every person have to uh, do the asana according to their extent, according to their flexibility, according to their body, I mean, uh, how much body allow to do that asana. So don't force yourself first. This is the very first thing I want to say with everyone, whoever watching the video, this video. Don't stretch yourself or don't force yourself for doing any asana. Try slowly the gentle positions. That will be more effective comparatively. Otherwise it can asana can convert into an injury also if you are not doing it properly or without any supervision, or without the beyond the limits, your limits, the particular person's limits, because every body varies according to the things and the therapy and ongoing treatment, or the treatment already done. So depends on body type, person to person. The same, like the asana, the same is pranayama for healing. For the head and neck cancer survivors, breathing can be both a physical and symbolic challenge. Radiation may cause dryness, shortness of breath, or discomfort in the throat area, yet mindful breathing or pranayama offers one of the most direct way to regulate the nervous system and promote calm. The some of the simple safe techniques include deep diaphragmic breathing technique, expands lung capacity and relaxes tight chest muscles. Ujjayi breathe, the ocean breathe, can also say. Gentle throat contraction during inhalation and exhalation improves awareness and control of respiratory muscles. Alternate nostril breathing like Nadi Shodhan Pranayam balances the two hemispheres of the brain, promoting mental clarity. So, some of the studies have shown that regular pranayama practices can lower heart rate and blood pressure also, reduces anxiety and improve oxygen efficiency, all beneficial in cancer recovery. Breathe in yoga symbolize life force. For survivors, reconnecting with their breath often marks the emotional turning point between surviving and thriving. Very important. So, these three are the simplest breathing techniques, highly effective on the cancer patients, basically. Healing the mind, meditation through meditation and mindfulness. Cancer doesn't end when treatment does. Many survivors describe the months after recovery as confusing emotional landscape, fear of recurrence, body image struggles, and post-treatment fatigue can cloud the joy of survival. Meditation and mindfulness offer tools to navigate the inner terrain. They teach awareness without judgment, observing thoughts, sensation, and emotions as they come and go. Mind based practices commonly used in rehabilitation include body scan meditation. It increases the body awareness and acceptance of the physical changes after surgery. Loving kindness meditation like rebuilds compassion for oneself and others. Mindful movements like combine gentle yoga flows with conscious breathing. Neuroscientific research shows that meditation can rewire stress pathways, enhancing areas of brain linked to emotional regulation and resilience. So for survivors, this can mean sleeping better, feeling calmer, and reconnecting with their sense of purpose. For example, uh, a lady, 52 years old teacher who underwent surgery for tongue cancer. After treatment, I couldn't speak clearly, she says, and even swallowing water was very painful, she recalls. When my therapist suggested yoga, I thought it was impossible. But through slow breathing and gentle stretches, I found strength I didn't know I had. Another patient, a software engineer who battled throat cancer, said, yoga becomes my anchor. He says it helps me sleep again, reduce my anxiety before checkups, and gave me the confidence to socialize. So, these stories echo a universal truth that healing is not about the body, it is about rediscovering the wholeness. For the best result, yoga rehabilitation should be integrated with the medical supervision. Certified yoga doctors trained in oncology care can adapt postures and breathing practices to each patient's condition. Collaboration between oncologist, physiotherapist, speech therapist, and yoga professionals ensures safety and effectiveness. For example, a yoga therapist or a doctor may coordinate with a speech pathologist to design breathing exercises that complement voice rehabilitation. Patients should always seek programs or practitioners who have experience in cancer care or medical yoga therapy. They emphasize individualized, gentle progression rather than intensity. Maintain open communication with the patient's medical team. So, yoga is complementary or alternative also with the traditional treatment of cancer like chemotherapy and radiotherapy. So, holistic approach is very important when there is a thought of treatment of a cancer patient. Despite growing awareness, yoga in cancer care still faces myth and hesitations. Some patients worry that they are too weak or not flexible enough. Other fear it is a spiritual or religious practice incompatible with their beliefs. In reality, yoga in rehabilitation is secular, scientific, and personalized. It doesn't demand perfection first. It celebrates progress, however small. Even 5 minutes of mindful breathing or gentle movement can make a noticeable difference in pain level and mood. Adapted yoga can be practiced in hospital beds, on chairs, or at home also, requiring a special equipments. Requiring no special equipments. What matters most is consistency and compassionate self-awareness. For head and neck cancer patient, the broader benefits um, can be better posture and mobility, easier swallowing and breathing, reduced shoulder pain, greater independence in daily activities, improved body image and confidence, which enhanced social reintegration. Perhaps the most profound outcome is renewed sense of identity. Survivor who practice yoga often describe a shift from seeing themselves as a patient to viewing themselves as participant in their own healing journey. And now the question is how we bring yoga into rehabilitation program. Yoga centers or wellness institutes now including yoga these days in rehabilitation pathways. Program vary, but typically generally includes initial assessment, customized plan, initial assessment like reviewing medical history, mobility, and energy levels. Customized plan like selecting safe movements, breathing, and relaxing techniques. Then they design like a group. I mean, patient is comfortable with group session or one-to-one session. This facilitated by oncology trained yoga doctors. Or home practice also includes like simple routines supported by printed or digital guides. Progress review, like w- I mean, how progress regular evaluation is also important part after the yoga sessions. Regular evaluation can be done by the healthcare professional. So online yoga session have also expanded access for survivors in remote or underserved areas through proper screening and guidance remain crucial. So practical tip for survivors can be get medical clearance first for if they want to include themselves in any kind of yoga program for rehabilitation. So discuss any physical limitations with the oncologist or physiotherapist. Uh, they're on board. Start slow and listen to your body. Even a few minutes daily workout can help. Focus on breathe and awareness, not achievement. Yoga is about connection, not competition. Like seek qualified guidance for it includes like whenever you want to enroll yourself for a yoga program for rehabilitation, look for certified yoga therapist experienced in oncology care. Stay consistent with the yoga program. because healing happens through steady patient effort. And don't be impatient during the practice. Celebrate the small victories, because very important part, like regaining comfort, flexibility, or confidence in significant process, you should have to celebrate during the, like, if you achieve a little bit milestone even also, you should have to celebrate that. um, the inclusion of yoga in cancer rehabilitation reflects a larger movement in healthcare towards integrative medicine, which values both clinical precision and human connection. More oncologists and rehabilitation specialists recognize yoga potential not only as a supportive therapy but also preventive and empowering lifestyle tool also. The ultimate goal is not perfection but participation, helping every survivor live with greater comfort, confidence, and compassion for themselves. Cancer changes everything, but it can also reveal new dimensions of strength. Yoga, in its gentle and profound way, reminds survivors that healing is not a race or a return to the old normal. It is the art of discovering a new normal, rooted in awareness, acceptance, and self kindness. In the quiet rhythm of breath and movement, head and neck cancer survivors find themselves. Modern medicine alone cannot prescribe a sense of wholeness. As one survivor beautiful put it, yoga didn't cure my cancer, it healed my life. It is very important. So, yoga is a very important part in rehabilitation. It heals mind as well as body both. It is a complete healing process. And if a cancer survivor or a cancer patient include yourself or enroll themselves for yoga therapy program, they can easily not it is not appropriate word, not easily, but yoga supports them to win the battle and live freely and reconnect their new life to the new normal, not like previous days, but the present time with the new body changes. Thank you. Thanks a lot for patient listening.